May Allied webinar. Hello once again. We're now recording. This is our May Allied webinar for Health Tech Academy. Welcome everybody. I'm seeing that a lot of participants are joining in, so we're just going to give it a minute, 30 seconds to a minute to let everybody settle in, and then we're going to begin. Yep, just a few more people. Hello everybody, welcome. Welcome to this month, which is May, the Allied Healthcare webinar by Health Tech Academy. Wonderful, everybody's using the chat section. We all can introduce ourselves. That would be wonderful. Let's get started without further ado. My name is Ian Fuller. I am one of the leaders in the admissions department, and that basically means that whenever a student such as yourself puts in an inquiry about any of our programs, it's either me or one of my teammates that is going to be, answering the call, is going to be answering all of your questions, giving you a brief introduction to the program, going over all of the enrollment steps and everything in between. You're basically speaking to me or one of my teammates. Yeah, that's basically a little bit about myself. I have been in the healthcare space for at least about, I would say, 5 years now. And I'm with the admissions team, one of the leaders, as previously mentioned. Uh, the objective of this webinar is basically to give you guys a really good idea as to what Health Tech Academy is all about, what kind of programs we offer, and to just give you, all of the information right here that, would help you make a best decision for yourselves to join the allied healthcare space, to join Health Tech Academy. And yeah. Um, at HTA, we're really passionate about helping students achieve their goals and objectives, especially in the allied healthcare space. We really pride ourselves in creating the next generation of allied healthcare sectors. For most of this webinar, you guys will be looking at my screen. I'll be sharing it with you very shortly. And so just please familiarize yourselves with Zoom. There is a Q&A section right there at the bottom right. Whenever you have a question, feel free to drop it. I'll probably spend the last 10 to 15 minutes going over Q&A, but I don't want you to miss out on anything. Sometimes we do have brain fog. So just type it in then and there so that I'll get to it hopefully either in between breaks or either right at the end of it. So feel free to do that. Yeah, and right at the end of the webinar, we will also be discussing some exclusive deals and discounts. I'm sure a lot of you are really looking forward to those, so do stick around for that right at the end. I am now just going to be sharing my screen. Give me a moment to get set up here. You guys should be able to see my screen right about now. I'm just going to give it another few seconds to load properly. Right. We're going to go full screen. Right, so let's dive right into it. A brief introduction about Health Tech Academy. We are based and located out of Austin, Texas, but all of our team members, we're based globally, right? We have team members, in at least 7 to 8 different countries spread across the globe. With a cumulative experience of over 25 years, each team member brings to the fold within the edtech space. That's online learning, education, technology, if you want to call it that, and a cumulative experience of 15 plus years in specifically within the healthcare space as well. We have about 20 plus instructors on our platform right now, each bringing in a wealth of experience. All of our instructors at least have 10 plus years of experience. So these are seasoned professionals that are going to be helping you throughout your journey with this. Over 220, I think this figure has yet to be updated. I think it's close to 2,500 right about now. But yeah, let's take it at 2,200, and we're bringing in 150 to 200 students monthly, fresh students that is, such as yourselves. Hopefully, some of you will be joining us. Yeah, and apart from that, we have about you know. All of our team members really pride ourselves, as previously mentioned, in helping. We all really try to cooperate with the students as best as we can, best of our abilities, and to try and make this process as smooth for you as possible, as stress-free as possible, because we do understand a career change for a lot of students is a really stressful time. You know, you guys have been in one field for a really long time, and a lot of you are transitioning. So it's an experience that we feel that can be a little scary, but obviously, we try to be as friendly and as up to date, giving you the best knowledge, giving you the best education as possible to help you out. So let's move on to the next slide. We're going to be covering all of these things in today's webinar. We're going to go over some more details about Health Tech Academy, what we at Health Tech Academy see the future of allied healthcare to be. We're going to go over all of our programs step by step. I'm going to try. I usually get really lost because that's my forte. When I'm talking about programs, I get really passionate, but I'll try keep it within time. And yeah, we're going to go over the admissions process. We're going to go over the financing options that we have, what career services we offer to all of our programs. We're going to listen to some student testimonials, read upon them, and right at the end, we're going to have a Q&A session. All in all, this should not take more than 45 minutes to an hour, but hopefully we'll try keep it in time rather than above time, as I did go a little above time last time, I remember. So I'll try to keep it a little down. Um, what we are and what we do. Let's get right into it. We're a leader in flexible and accessible online training for the past 20 years. As I mentioned, we've been working in the ed tech space for a really long time now, and we've gotten into the allied healthcare ed tech space also, within the past 5 years, 5 to 6 years now. We build our programs around the growing areas in allied healthcare. As of right now, I believe we have 19 to 20 different programs live on our platform. So these are different programs all coming in with different certifications on our platform live. And we're looking to grow this number, hopefully uh, by at least double within the coming year. Right. Um, and yeah, our vision and our mission is right there at the bottom. I'm going to read our vision, and then you guys can also read the mission for yourselves. I'm going to leave it on the screen for just a moment. Health Tech Academy aspires to transform and innovate the way healthcare professionals are educated, hired, and retained. So we're using a lot of state-of-the-art technology. We're using a lot of artificial intelligence into our platforms, and we're trying to make this the process as streamlined and as user-friendly and exciting as possible for the students. Um, all of our programs, they're tailored to fit each individual schedule, right? Because we're online, we also pride ourselves in being completely flexible and completely self-paced. The student, is in the driving seat. You decide how much time you're putting in to the education, and it's going to fit perfectly around your schedule. So it's basically designed for a wide variety of students coming into the program. Um, right. We are creating our boot camps with industry experts alongside us. We have partner universities who we take inspiration from time and time again. Employers, where we're dealing with a lot of different employers, as well as a lot of different healthcare providers and partners that we have. We're taking everybody's input into account before creating an industry aligned boot camp, right? So this is exactly the kind of education you need in order to get a paid position within your timeline. That's the objective. The objective is for the student, I'll repeat that once again, it's for the student to get into a paid position of their choosing, obviously, which certification they're going for within their timeline, according to their schedule. So that's exactly what we pride ourselves in providing. Um, yeah, we've covered that. And the three key aspects, again, are going to be that it's on demand, You start the program whenever you are ready to get started. There are class start dates according to the instructor batches we're picking in, but anybody can get started for any of our programs at any time, right? It's self-paced learning, putting the student again in the driving seat. They can decide, how much time they're putting into the program, and that in turn will decide how soon they complete the program, right? So it's going to fit around your schedule once again. And we also have one-on-one coaching because our program is self-paced. We're not just going to leave the student alone. It's not just going to be you doing all of the work. You do get a lot of different kinds of assistances. One of those, and the most important in my opinion, is the one-on-one personal coaching attention that we give to each student, right? They're all going to be with the industry aligned experts, as previously stated, each coming in with 10 plus years of experience. So whenever you have a coaching session, booked, you should be completely easy that you're going to be speaking to a real professional, a real seasoned, trained and seasoned healthcare professional, and who's going to be not only answering your questions related to the material, but also possibly mentoring you, right? A lot of our students share their personal details, go over some of their past experiences, their 2 year plan, their 5 year plan, and our instructors are able to really draw kind of like a roadmap for them, give them some best practices, give them some really good ideas as to how they're supposed to navigate through this journey at Health Tech Academy. Yeah, we're gonna go right there at the bottom. Here are some of our partners that we work with. As you can see, we do have a couple of universities as our partners, and we're affiliated, and we have a lot of accreditations with the affiliate bodies. Basically, since we're providing different certifications for different programs, we're affiliated with most of those affiliate bodies, meaning, I'll give you a quick example. For the medical assistant program, the certification we provide is of the CCMA, right? The certification is called the CCMA, the Certified Clinical Medical Assistant. The issuing authority, or the organization body, if you want to call it that, is the NHA. So we're officially partnered up with the NHA. We're affiliated, we're accredited, and that way we're able to provide you that specific course of the NHA, being the CCMA. And we have a lot of other partners as well. Um, Program flexibility, that again ties into the same thing. They're designed for the wide range of people. Being completely flexible, if we get a student right out of high school, and that happens a lot, looking to get into the allied healthcare sector, they are really motivated. They have a lot of time to give because they're usually on breaks. They can give in like 5, 6, 7 hours a day at times, and they complete the programs very, very soon, within a month or so. We've had one of our students just last month. They completed the program within 3 weeks, and it was one of my students. I was really proud of them, and we just had that conversation last week. It's fresh in my memory. And then we have some particular students, working mothers, people working double shifts. They can't give it more than a couple of hours per week, and so that's also completely okay. Our objective here is to give you guys the resources, is to give the students all of the tricks, the tools, the education that you guys need, to give you the support and motivation you need, to give you all of the instructor assistance that you guys need, and then the rest is up to you, right? Uh, Obviously, no relocation is going to be required for our programs. They're going to be online. You can do it from the comfort of your own living room, from your own bedroom. No problems with us. And again, yeah, completely online. I think we've duplicated this, so we'll go right to the next slide. The future of allied healthcare. I'm just going to take a quick pause, and we're going to dive right into it. So for the future of allied healthcare, as we see it at Health Tech Academy, pardon me, the allied healthcare roles are really high in demand right now, as they've always been, to be fair. And we foresee them to continue to be that way for a really long time. The allied healthcare sector is never going to be less in demand. There's always going to be an increase in the roles for allied healthcare. We do get a lot of questions, us advisors especially, as to, AI integration that's where our the trend is heading. That's where every company is looking to streamline themselves. And it's the same with the allied healthcare sector. Quick example right at the bottom is for surgical technology, right? Let's pick that up. Now, for surgical technology, I'm sure you guys know that intraoperative imaging, which is like precise imaging while the surgeon is about to perform the surgery, is now possible thanks to some latest technologies. And then there's also robotic assisted surgery, which is now really taking place, to make some really precise incisions along with a lot of other things. So, in our opinion at Health Tech Academy, uh, the job roles are going to slightly modify. They're going to change, but they're never going to go. They're never going to be eliminated. The I would say the um, us implementing AI into our daily lives, into our workforce, is that where one medical assistant was able to cater to, let's say, 20 patients per day, he will perhaps be able to look at or cater to 40 or 35 or 40 people per day. That's the objective of AI. That's what everybody is looking to do, to streamline processes, right? It's never to eliminate the human. It's always to assist the human, to make them perform better, to make sure that the risk of I would say error is reduced by a huge number, by a huge percentage. So that's basically the objective, in our opinion, within the AI industry, the AI trend booming right now, and the new technologies. And the only way to get into this is to make sure that we have got the train, we're at the platform, and we're basically ready to jump, right? Start with the basic certifications that either we provide or that you want to get into, and then always look to upskill yourselves, right? Whether it is taking webinars such as this one, or basically just keep on getting certified, keep on looking for new opportunities. And that is the way to stay on top of the game, right? That is the way to stay completely relevant in the industry for now and for years and years to come. That's the way we look at it. Some other examples are right there stated at your screen. For pharmacy technician, for pharmacy technicians, there are automated dispensing that's now happening. So that's a lot of release or ease for pharmacy technicians, and there's a huge amount of change in the software management softwares that are now taking place. For sterile technicians, there are a lot of I would say automated packaging softwares for the particular tools. And so the job is going to be the same. You perhaps will have to cater to using those specific machines, or I would say increasing the number. I would say because of this, you would be able to cater to more patients. I think that's the best way to put it. So yeah, that's the future of allied healthcare as we see it at Health Tech Academy. Let's move on to the next slide. Right, we're getting into the programs now. This is what I'm most excited about, because I am going to go on for quite a bit. We're going to go over all of these programs step by step, and let's dive right into it, right? Surgical technologist. This is one of our most popular programs. It is I would say, medium to intermediate level certification. So people just entering into the industry are I usually tell them to start off with a more entry level certification, but we have had students in the past just get into the industry and able to land jobs. So it is depending on situation and student as well. Most of our programs are going to be 16-week in the duration, as you're going to see, but this 16-week is a ballpark figure. It's an average figure that we give to the students, because ultimately the students get to pick and choose their own timeline, right? But if the student spends about, I would say, 12 to 15 hours per week on the material, for most of our programs, they're able to complete the program within 16 weeks. For this particular boot camp, the surgical technologist program, the certification that you are preparing for as part of our program is called the TSC. the Tech in Surgery certified by the NCCT, the National Center for Competency Testing. They are the issuing authority, and we're officially partnered up with them as well. The full tuition for the program is going to be 3450, and there are going to be some discounts on offer. You can talk about that to your advisors, or we'll go over that as well at the end of this presentation. Monthly payment plans are available. They start from 266. The eligibility criteria is quite simple. You need to have a high school diploma, GED equivalent. You need to have a stable internet connection, obviously a laptop or PC too. Be able to take the program. The offerings for the surgical technologist program are some of that. This is going to be a little repetitive, but do bear with me. I'll try to keep it as informative and as possible. So self-paced learning, obviously, that is the route that we take for all of our programs. There is one-on-one coaching and mentorship available. So the student gets to set 5 of these sessions with industry experts. Um, there is a specific exam preparation course. Once the student completes the program with us, with the online education, they're given a specific exam preparation course, after which the exam voucher is also added or given to the student. So the cost that we just talked about a little earlier, that's going to include the official exam voucher as well as a prep course right before that, which includes roughly 4 to 5 practice exams as well, which is absolutely important before giving the final exam, in my opinion. With that, there is going to be career support. Our career support, we're going to go over the career support in a lot more detail later in this presentation. But just to give you a quick, a tidbit on that is basically that every student gets to have multiple sessions with our career service advisors. There is going to be various tips and tricks they share, and they assist all of our students in getting paid opportunities as well as clinicals, right? Externship support, again, is going to be provided. There are 4 programs that we provide, I think, yeah, 4, that have a clinical requirement. Surgical technology is one of those programs. What a clinical requirement is that after completing the examination that you're preparing for as part of this program, you also have to complete a certain amount of hours physically, right? Now, you basically as an intern or an extern working alongside a real surgical technologist, shadowing them, learning the ropes basically of the job. And for surgical technology, 125 surgical cases is the requirement that the NCCT has kept in order to get certified. So if you complete the program and if you pass the examination, that is only half of your requirement complete to gain your full license and certification. You also have to complete the 125 surgical cases in order to release your full license. So what we do is we assist the student looking into their particular area into helping you find a clinical site near your location. And once you're able to get one of those sites, you have to complete the 125 surgical cases, which can take roughly a couple of months. And that is when your license gets released, and you get to apply for different positions, which also we help you out with. Uh, there are a couple of restricted states for this particular program. I would like to point out first, clarify basically what restricted states are, right? There are some states that have some additional requirements. So apart from completing the NCCT license, for some of these states, there might be an additional requirement to register yourself with a certain body. That's usually the case for some restricted states. And there are some states that opt for a different certification altogether, right? We do have a specific list on our website. If one of my team members can put that right into the chat, that would be wonderful. There's a state compliance page that we have on the website. So whichever state you're located at, pardon me, all you need to do is click on that particular state. It'll, give you an entire list of what programs are available in that state, or if they are not particularly, available for that state. So that's just a little bit about what restricted states are. For some restricted states as well, if they're in the yellow sector, meaning that if there's an additional requirement, the students can still do the program, right? And then obviously we can guide them or give them the next steps as to what the additional requirements are, right? So you can ask your admissions advisors about that, and they'll be able to provide you some more clarification and detail on that. It's going to be different for different programs. So for the most updated list, it's best that you check that um, state compliance sheet, which I'm sure is going to be shared with you in just a moment. Moving on. We're going to go to the medical assistant program. This is a program that I usually work really closely with. And again, this is 16 weeks, but that's an estimated figure. The certification you're preparing for is called the CCMA, the Certified Clinical Medical Assistant, and the issuing authority is the National Health Career Association, which is the NHA. The full tuition for the medical assistant program is 1250. So this is one of the uh, lowest costing programs that we have at HTA, and the weekly payments are starting just from $49. So this is one of the most affordable options for most of our students to get into the industry as a medical professional, as an allied healthcare professional. The eligibility requirement for most of our programs is going to be the same: a high school diploma or GED with a stable internet connection and a laptop to take and do the program. Well, the offerings are slightly different because this is one of the most cost-effective options. There are a few key features that are not going to be included. The self-paced program remains the same. You do get career services with the program as well. You get your ebooks and your skill videos as well. The online, I would say the one-on-one coaching sessions is not available for the basic package of medical assisting, and the exam voucher is kept separately, right? There are a few restricted states, but you can check the updated list on that particular link just shared with you. Uh, the medical assistant program has been split up into two separate offerings, right? This is the one that I've shared is the basic package. This is for usually those students who just want the education and perhaps do not want the exam voucher, or I would say that a lot of students who are already operating in the medical industry, their hospitals are usually able to pay for their vouchers. And so we had a lot of requests for this particular plan, which is why we kept it. But we can offer you the exam voucher, the certificate preparation course, as well as live coaching sessions. We've dubbed that program the Medical Assistant Plus package, and that's priced at $2,000. Payment plans are available, discounts are definitely available, and you can ask your admissions advisor about that separate offering as well. Let's move on to patient care technician. And the CPCT is the certification name, also by the NHA, roughly 16 weeks, but as we know, it's going to be based off of your schedule. The entire full tuition is $34.50 with payment plans available starting from $266, and we also are able to offer this at a discount right now. High school diploma, GED, and your stable internet connection is a requirement, pardon me. The offerings are going to be pretty much the same as for the surgical tech, the um, apart from the 125 surgical cases, right? So there's no clinical requirement here for the patient care technician. In order to fully get your license, all you need to do is prepare for the certification exam and pass the certification exam. That way, your full license will be issued to you. Program offerings obviously are going to be the same. Self-paced learning, one-on-one coaching sessions are going to be available. There's going to be certificate preparation. There's going to be career support, your ebooks, your skill videos, your exam vouchers, all added to this particular plan. The pharmacy technician, and then I believe we have the pharmacy technician professional as well. Basically, we have two separate programs for pharmacy technician. One, they're basically differentiated between the certifications we're providing, right? So the CPHD by the NHA, the National Health Career Association, is the first one that we offer for those particular people looking to get the NHA particular certification. And the second program that we have for pharmacy technician, we've dubbed it the Pharmacy Technician Plus. Just give me a moment while it pulls up. Oops, one moment. Here we go. My laptop seems to be misbehaving today. No worries. The Pharmacy Technician Plus program. This is a different certification by the PTCB. Usually, for most states, they are interchangeable. Both of these certifications are accepted for similar roles. However, there are a few restricted states that are different. So, based on your state, I think that would be the best decision. Or, I think if this is the program that you're interested in, another really I would say promising thing you could do is look at the hospitals in your particular area, look at the pharmacies in your particular area, ask them which particular job roles they have available and what are the requirements for them. If they have a specific certification they prefer, then that's the one that you should eventually go for. The pardon me, the offerings are pretty much the same. It's going to be self-paced learning. It's the one-on-one coachings are going to be available. Certification preparation is going to be available. Career support is going to be there for you. Ebooks, skill videos, exam vouchers, all added to the program. For the restricted states for pharmacy technician and pharmacy technician professional, the separate certification, do check out the link for for the most updated information regarding that. 16 weeks, 3450 being the total cost for both programs, starting at 266 on the installment plan, and the eligibility is going to be the same. We're going to come over to the dental assistant program. This particular program for dental assistant is the RDA certification by the AMT. We're officially affiliated with them as well. Again, 16 weeks. Full tuition being 3450 with discounts available and plans starting from 266. Same eligibility as the other programs, same offerings as the other programs, and the restricted states are for the most up-to-date restricted states. You can definitely check out the link. For dental assistant, we have noticed a really good turnover in terms of job placements, right? These are the people who and this is don't quote me on this. This is just something that we have observed. I think me and some of my fellow advisors that whoever comes to us for for a dental assistant are usually the first ones through the door and into a paid position. So this is one of those programs I think that really has a lot of potential. Uh, Sterile processing is again our second program, which has a clinical component attached to it. So I'll get to that in a moment. Let's talk about the generic things for the program first, being that it's also 16 weeks. You can complete it in 16 weeks or less. The certification is called the CRCST by the HSPA, and the full tuition is 3450. Once more, plan starting from 266. The same eligibility requirements. Let's get to the particular offerings. But yeah, for this particular plan, no restricted states. So you can basically be doing this throughout the country without a worry. For the offerings, obviously, self-paced learning is the method that we've chosen for all of our programs. There is one-on-one coaching available. Certification preparation is definitely available for this. And then the exam voucher is also given to you within that pricing, no additional charges. Your ebooks, your skill videos, your externship support, we'll get to that, and career support are always there. For the sterile processing program, the clinical component requires you to complete 400 hours of clinicals in order to release your full certification, meaning that once you take the program with us, you prepare for the exam, you do the practice exams, you do the final exam, the CRCST exam. That is half of your requirement met. Then we need to help you find a clinical site, and this is more entry level friendly. So people just getting into the industry are more likely to get a clinical site rather than surgical technology. Right. So for sterile processing, I usually recommend this to students who want to take that route, because whenever you join into the industry as a sterile processing technician, usually the next role or the next steps are that within a couple of years you eventually get to become a surgical technology. So I would say getting that being a lot of people's ultimate goal, this is the first step into that. And for this, the 400 hours are mandatory. You have to complete those 400 hours working as an understudy, working as a student, observing a real sterile technician do their job, perform their trade well, and that way get to release your full certification. Basically, these specific bodies, the HSPA, the NCCT, they then verify They connect with your hospital, whoever or wherever you've done your clinicals from. They verify your hours before releasing your certification. So that's just a little bit about how that works. Let's get to the next program. We have a few more to cover. Phlebotomy technician, again, is one of the programs that does have a clinical component. However, it is one of a relatively shorter course, so it's not going to be 16 weeks. We estimate if you're able to give it 10 to 15 hours a week, you can complete the entire program within 3 months. The certification is called the Certified Phlebotomy Technician by the NHA. Full tuition for this is slightly lower at $2,000 since this is a shorter course, and discounts obviously are going to be available, and monthly plans are starting from 141. Uh, Eligibility is the same. The offerings are going to be pretty much the same, despite it being a more cost-effective program. You do get one-on-one coaching sessions with this. You get your exam preparation courses, you get your practice exams, you get your exam voucher for the NHA exam as well. Career support is obviously going to be there, and externship support is also given. So this kind of has a smaller externship requirement, I believe 30 capillary sticks, pardon me, 30 venipunctures and 10 capillary sticks need to be performed. All in all, it should not take more than like a couple of weeks to get this sorted out. We've had students completed within or under a week as well, these specific externship requirements. So it's a relatively shorter course with a shorter requirement. And once you meet these requirements, you can release your full certification. And phlebotomy techs obviously are hugely in demand as well. And yeah, there are a few restricted states for this, so do check the list for the most updated, state awareness. Medical coding is one of our programs that we offer. It is also coupled with the second program, which is medical billing and coding. So usually, pardon me, right here we go. Uh, People just starting out to the industry, medical billing and coding is what we recommend. Right, the certification is the CBCS by the NHA, and more so the job roles are towards the billing side of things, and that's the start. If a person is coming in fresh, if a person is coming in without an experience, this is where they want to start off with. Same tuition being 3450. Yes, this particular program is also for 12 weeks, but there are a lot more resources that go into this, which is why it's priced at 3450. Offerings are the same, eligibility is going to be the same. There's no externship requirement for this. And for those students who are already in the industry, I would say the medical coding program is more, um, I would say, beneficial for them. The full tuition for this again is 3450. I think this is a bit of a typo, but I will get that verified and checked once more. 14 weeks long course. The certification is called the CPCA by the AAPC, and the eligibility and offerings are pretty much the same as discussed. Um, for the healthcare IT program, for this particular program, we're preparing you for not one, but two separate certifications, right? The ITF Plus by CompTIA and the CEHRS by the NHA. The NHA is, one of those providers who has multiple certifications that we're able to provide. This again is going to be 16 weeks roughly. And these two certifications are what you're preparing for. The cost is slightly higher at $4,000, $3,950 to be precise. And discounts are on offer. Plans are starting from 322, and the same eligibility and offerings are given, and the restricted states can be checked by the link. Now, the medical health record specialist is usually where the person wants to start, even if he wants to get into the IT side of things. As you can see, it's the same certification, right? So usually if a student is coming in fresh, not in the industry, this is where they want to start. The CEHRS by the NHA. And it's again, one of the shorter programs being at 12 weeks, the full tuition being $2,000, the eligibility and offerings being the same, including the live coaching sessions, the practice exam, the exam voucher, and everything in between. The restricted states again will be checked. You can check from the link provided. The EKG technician program is now really getting into full swing. We're getting a ton of inquiries about EKG. I think it's on the rise right now. This is the last program that does have a clinical component to it, but like the phlebotomy program we discussed earlier, the externship for this is also very, very small. It's a very, very, I would say, small externship requirement. I believe 10 live EKGs need to be performed. And the NHA, once they verify that, are able to release your full certification. So just to recap, you need to perform and you need to pass your examination, as well as do these 10 live these 10 live EKGs on live patients. And that's when your full certification is received. And you can apply for different positions, which obviously we will help you out with. 8 weeks long, this is the shortest course that we have, the full tuition being $2,000. CET is the name of the certification, being certified EKG technician by the NHA, monthly plan starting from 141. And the offerings are going to be the same, with live coaching sessions, with the exam voucher, and all of the regular offerings that we have for our programs. The last program I'm briefly going to touch on is the Healthcare Leadership Program. This does not have a certification by a different body, but it's our own in-house certification. This is designed for those individuals already in the healthcare sector who are looking either for management roles or looking to become better team players, because leadership skills are hugely important, not only for leadership positions, but even for team members who are looking to perform well, who are looking to be cohesive within the unit. This is an extremely important program. And we're really proud of this. We've created it ourselves. It's priced at 3950, and it's going to be starting. Plans are going to be starting from 322, and the offerings are going to be pretty much the same. You do get live coaching sessions. In fact, we really prioritize coaching sessions onto this, and since it's in house. The people who have taken this program have the satisfaction rate has been top notch. So that's something we're really proud of at Health Tech Academy. We've covered the pharmacy professional as well. So let's move on to the next particular slide. I'm just going to take a brief moment and we'll do a quick demo of our learning platform. Right, so I think I need to exit my full screen. Yep, my screen is being shared still. Perfect. So this is what our platform basically looks like. Yep, here we are. This is a test account which we use to test our various products. So this is going to have a lot of different boot camps over here. But for you, for most people, there's just going to be one boot camp right here, the one that you've chosen. For this particular example, let's go with straw processing. It's gonna keep popping up the profile because obviously it requires you to complete your profile or specific platform. But for now, we're just gonna click on complete later. So this is what it exactly looks like. It's gonna have all of your courses right here. Just give me one moment. Right. So this particular feature is going to let you see the certification you're going for. After each module of the video, you do get a separate certificate which you can download. As you can see, this particular test account has a ton of certifications because we do test that out, as I mentioned. And then obviously a progress report is going to be coming over here. Right now it's at 0. But yeah, and this particular tool that we've recently added is for general job outlook. So just to give you a quick recap, pardon me, not a recap, but just general information. Let's click on straw processing and let's click on Virginia as this for this example. We're going to click on next. We're going to look at an intermediate person who's looking to get into the industry. And then we basically can see what the average salary is going to look like, how many job openings are there on NLX, Indeed, and BLX. And once you click it right here, it's also actually going to take you to the analytics page to actually apply to different positions, what the career outlook is looking like, how many stars as per standard, and these are the stats it's getting it from. Um, yeah, and I'm just going to go back to boot camps, and I think I wasn't able to of those programs. Uh, let's look at the dental assistant as well. Right, there it is. So this is basically how you're going to be seeing your courses. Let's click on the first one as this example goes. And right over here is going to be your lesson. Whenever you're coming back, it's gonna, welcome you back. We've added that as well. Uh, and all of your specific courses are going to be right here on this right hand side tab. There is an AI learning assistant right here as well, which will allow you to interact and ask particular questions. And this particular tool will allow you, or it will give you specific answers directly from the material that we've provided. You can also use this particular feature to book a session with one of your coaches. You can see we have for this particular account, we have used 5 and 3 remaining. So these are the two coaching sessions, coaches, pardon me, that you can book. Let's just, for as an example, look at Christy. We're going to see Christy's profile right here. And right when we click on book a session, it's going to take her to her calendar where we can actually set up a time to book a session. Over here, there's going to be some other features, some feedback features, your profile. There's going to be analytics. So whatever, how much time you're spending, on the platform, where you're spending your time, what you're exactly doing is going to be right here. How, there's a quiz section after each module as well. What the number, pardon me, what numbers you're meeting is going to be right here in the progress report, and your enrollment documents and a few other key features in the document section right here. So this is just a brief tutorial of the platform. It does cover a lot of various other things, and you can speak to your advisors about a demo for this as well. Coming back to the presentation, and yeah, give me one moment. We're next going to be going over the admissions process, right? I'm right at the end. Give me one moment, please. Right, so we've done the demo of our learning platform, and now let's get to the admissions process. The admissions process is as simple as can be. You put in a request for more information, or you can give one of the numbers on our website a call directly. One of the admissions advisors will get in touch with you with calls, with emails, with texts. Whatever you're comfortable replying at, that's how you guys can connect. You guys can talk about what the requirements are for the program, when you guys want to start, any particular questions you have. The admissions team is very friendly and very open. They'll be discussing anything and everything with you, going over any questions, going over competitor pricing, going over, the industry standards, going over anything that you want to talk about. And then obviously, whenever you finalize your particular program, you can finalize which payment plan you're going for, because we do have a multitude of payment plans. We will discuss that in just a moment as well. And then you can complete your enrollment fee, your enrollment, and then the admissions advisor will be able to process your enrollment. And then within 24 to 48 hours, all of the students are able to start their learning with us. It's a very simple process. Let's look at the financing options in a little more detail now. Whenever a student decides to pay the program off in full, right, before they're starting the program, we call that the upfront payment. And usually between 30 to 40% discounts are easily given to the students. So we're going to have that available for some of our webinar students as well. We'll cover that right at the end. Monthly installment plans. We have an in-house system as well, which basically is going to allow you to go for payment plans which are interest free. Right. So if that's something you want to do for 12 months, most of our programs are spread out across 12 months interest free. So that's one of the popular options that we have. Or you can also go through one of our financing options, financing partners, pardon me, Ascent, Fortify, Edley, Sally Mae. We also have a firm later added. So these are some of the partners you can use based off your credit score, based off of your income. That they usually give you an exact amount as to how what your payments are going to look like. Usually, some of these do have deferred payments, meaning you don't have to pay right now. You can start your payments a little later, and they're usually spread out between 24 to 36 months, and that's obviously going to be based off of your credit score and your income. The study now pay later option is also available with a firm. So if a firm is something you use, it's a very simple process to study now and pay later. Career services. So hiring is a very personal decision based on a variety of unique variables, right? Uh, hi, at Health Tech Academy, we basically uh, help each and every student out. I'll give you the exact tools and tricks we actually employ, but just to tie it down to the image as well. We at Health Tech Academy try not to hand you the fish right in your hand as to giving you an internship, because online training schools, we're not officially a hospital. We're not officially able to give you direct clinicals. But we can do is train you and teach you how to catch the fish for yourself. So we definitely look at your recommendations, because a lot of students are coming in with prior hospital experience, with loved ones in the industry, and that's usually a really good way to get your clinicals and paid opportunities. Another way is through our prior links in hospitals we have connected with and worked with in the past. So that is also given to all of the students. If a hospital or clinic we have worked with in the past is near your area, then definitely we recommend you to go with them. But more often than not, I would say the best way to go about is to work seamlessly together. So we'll be giving you, the best practices you can start employing. We'll be giving you, various tips and tricks. We'll be helping you out with your CV. We'll be getting you LinkedIn connections, optimizing your LinkedIn, because that is, I think, networking is the best way to land opportunities in this day and age. And obviously, we're also going to be helping you out whenever you land interviews with interview preparation. So there's a lot that goes into these particular career service sessions, and we do everything that we can. We cannot promise, obviously, handing you the fish, but we can promise teaching you how to catch that fish. And then this particular process that we're doing together takes a couple of months. So we start the process early, not after you complete the program. We started while you're in the program, so that by the time you're ending it, by the time you're ready to take your certification, you have a clinical site lined up, you have a paid opportunity, right around the corner. So that's basically how we do things. We have now also added AI, artificial intelligence, to our career services resources and support. So basically, we are now using a special platform, a special tool to directly, go over some of the finer points like your CV. Then there are different positions that a student may apply for. They come with different names, and some of those feature, with some of these different positions that are there, have specific skills that are required. So this particular tool, this particular platform that we're using now, gives you exactly what you need to be doing, or exactly what skills you need to be adding to your portfolio, your arsenal, to get to those positions that you want to. Job interview practices, simulations are going to be there, along with job application assistance, because obviously there are some form fillings that are going to be some really lengthy, so the AI is going to assist you with that. There's going to be some progress tracking, because obviously that's something we have to do, as well as one-on-one coaching sessions, in which, as I previously covered, is going to go over a lot of details and a lot of best practices to get yourself into the industry. Let's look at some student testimonials. We are slightly above time, so I'm just gonna leave this here for you guys to read. We possibly won't have time to watch one of these student testimonial videos, but you can definitely ask your advisors, and they'll be able to provide you some of these videos as well. But yeah, I'm just gonna leave this right here for a minute for you guys to read. Right, moving along. we are going to get to the Q&A section, but before that, let's get over to the moment a lot of you might have been waiting for, which was the special webinar discounts. The webinar discounts that you're all going to be now qualified for the 3450 programs, you guys will get a flat 30% off. And instead of the 3450, you're going to be paying 2400, and you're also going to be getting a free laptop with that. So that's the promotion we have, especially for the people who've attended our webinar. That's all of you guys. And for the programs priced at 2000, like the Medical Assistant Plus, the phlebotomy, the EKG, and a few others, that's basically going to be for 1000. In fact, I think there's a bit of a typo. For Medical Assistant Basic, it's going to be $1000 with a free laptop. And for the other programs, it's going to be a different price. You can definitely consult your admission advisors. The QR codes are right here in case we'll give it like 5-7 seconds for you guys to, take pictures if you need to. And to visit the website, to talk to admissions, one of my team members, or to take a career assessment quiz if you're still unsure as to which path is the right for you. So take this quiz we've designed, and it's going to route you into the best possible way that you can get into the allied healthcare sector and what is going to be most feasible for you to do. Uh, let's now head on over to some Q&A. I will now also stop sharing my screen so I can also go over some of your questions, and I'll be looking at the chats as well. Right. Irma mentioned if we've gone over healthcare IT, definitely we covered that in detail. But we are a little short on time, Irma. I would recommend you speak to your admission advisor about it in detail. Just to quickly recap, healthcare IT is one of those programs that covers two certifications. It is going to be for 3950, almost $4,000, and it's going to be roughly 20 weeks long. It's going to have all of the coaching that you need given to you. You're going to have the online platform, you're going to have the exam voucher, the exam preparation course before that, and everything in between. um, let's look at another question that is coming in. How much is this course? I'm sorry, I couldn't find it anywhere. Dajia, you would need to specify which particular course you're talking about, but just to quickly recap, the most of our programs, such as surgical technologists, such as sterile processing, they're priced at 3450, 3450. With the webinar special discount that we have going on, you're going to be getting a 30% discount as well as a free laptop. So that's something that you can definitely avail for the medical assistant plus package. And for the phlebotomy EKG programs, those are priced at $2000. And there is a basic package for medical assisting due to high demand that is for 1250. That is completely self-paced. I do see another question here. Just give me one moment. Since the academy is based out of Austin, Texas, to utilize hospitals in the area for surgical tech? Absolutely. We work with a lot of different hospitals, Cheryl, throughout the country, and we try to form permanent partnerships. But in reality, the how it works is that we work with each student individually. Each student has their own preferences. Each student has their own specific area that they're not comfortable moving out of, right? So what we do is we look at your particular area, we cross-reference your particular, I would say, references, our particular references, and then we sit together and we try to find a clinical opportunity with the pair of us, right? There is a certain amount of a requirement that we have that the student does do, in terms of, finding those opportunities. And our advisors are also working tirelessly to, actually get you guys that particular paid opportunity. Um, is there a certain age that you have to be? No, there's no particular age that you have to be. You can take this program. If you are physically fit, if you feel that you are ready to get into the industry, then definitely you guys can get into it. Does the 30% apply to payment plans? You can definitely speak to your advisors about payment plans. The 30% is not going to be in effect, Patria, but there will definitely be something that the advisors will share with you. Um, Let me just go over one last question. Is Michigan a restricted state? Bridget, you can definitely look at the, I would say, the link that we've provided right here in this chat. And if you can't find it right now, and if we're running out of time, we can definitely go over, you can speak to your advisor and they'll share the exact details with you. I didn't see the healthcare leadership information on the website. Where can it be found? Preference, your advisor will connect with you. I'll make sure that you are given the exact information that you need to. It's there on the website, I'm sure. But in case you weren't able to find it, we'll get that information delivered to you. Let's field the last question. Um, Yep, I see. Hi, can you go over the search tech? Today is my first particular day. We are running out of time, Alka. I do apologize, but I will have your advisor connect with you and go over these details once more. I thank you so much for being with me. I see that we've had a lot of people stay till the very end. I really do appreciate it. Thank you so much. I wish you the best of luck in your allied healthcare journey. With us, without us, it's a wonderful step you're taking. It's really an amazing journey, and it's really a really giving and a really fruitful experience. And it's a really good opportunity and a really rewarding, I would say, opportunity for all of our students. So I thank you once again. I wish you guys the best of luck. Thank you for being with me till the end. Take care. Best of luck. Goodbye.